Hello and good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. Last year, the Health Ministry launched a Sugar Reduction Advocacy Campaign, which was spearheaded by the former Health Minister, Dr. Zaliha Mustafa. This in a bid to encourage Malaysians to reduce their sugar intake. But as we delve into a conversation about the efficacy of such initiatives, a pivotal question we must ask is what factors truly shape dietary behaviours of a population? Joining me on the show to discuss this further, I have Dr. Teoh, Research Associate at Khazanah Research Institute, where her research focuses on nutrition, public health and food insecurity. Before joining KRI, she also worked as a nutritionist, working with the Singapore Health Promotion Board to deliver and to manage health promoting activities. Dr. Teoh, it's so good of you to join me on the show today. Thank you for your time. As we talk about promoting healthier dietary habits, I'm just wondering if we could first look at the multifaceted factors that influence and shape an individual's food choice or food choices on a daily basis. What insights can you offer us into the various factors that that shape the dietary habits of a population?
Firstly, thank you, Melisa, for inviting me to share my insight on such an important topic with social and economic implications. So when we talk about food choices, healthy eating, we tend to see it, or at least people tend to see it as a personal responsibility, an individual choice. But more often than not, it is beyond a personal choice. Our choices, food choices, knowingly or unknowingly, are shaped by multiple factors that not so invisible factors in our food environment. So food environment is the context where we assess food and we make decision about the food to purchase and to consume. So it can be, for example, our school canteen, workplace cafeterias, supermarkets, restaurant, cafes. So actually, on a daily basis, our food choices are shaped by multiple factors. It ranges from the types of foods, retail, and service store that are available to us, the type of food and beverages that they offer, the prices of the food, how desire is the food to us, and our exposure to food marketing and advertising. All of these factors collectively shape our food choices. In a healthy food environment where we have an abundance of healthy food options and possibly also unhealthy food options, but because of the abundance of healthy food options and the desirability, maybe in terms of affordability, convenience, etc., that fits our lifestyle, it can promote us to help to make healthier food choices. But if an environment, in a food environment where unhealthy food is more abundant in terms of availability, more affordable, and with the effect of promotions and food marketing more desirable than the healthy options, that's not surprising that people like Malaysians, we see more and more Malaysians making the unhealthy food choices because they are, in a way, inclined to make this because of the environment, not because of their personal choice.
Okay, you mentioned food marketing a little bit, a couple times in your response. Can you share with us how food marketing and advertising practices, how that influences dietary habits, how that may shape the consumption of sugary products? I'm curious to learn more.
That's the good question, because food marketing and advertising, we rarely talk about this issue, but it is significant factors that drive our food purchasing and consumption decision, because all of us consumers are exposed to food marketing and advertising on a daily basis. For example, when watching TV commercials, while listening to advertisement on the radio during our commute. For example, also with the rise of social media, we are regularly and constantly exposed to sponsored posts and advertisement on social media, YouTube advertisement, TikTok, and so on. And on the social media, they are unregulated. So you can imagine the frequency. We might, the impact might not be immediate, but cumulatively and collectively, it can help to maybe subconsciously shaped our food purchasing preferences.
When you mentioned about the accessibility and also the affordability of food, right? So that also shapes the way we think about the choices we make for our diet every day. In Malaysia, is it true that more nutritious food is more expensive compared to the cheaper, more available, high sugar, high fat, high cholesterol food? How would you describe the landscape of food availability and affordability in Malaysia?
If you look at food availability, people might say that we are not short of nutritious food like local fruit and vegetable. Yes, it is true, we have them, but at the same time, we also have an abundance of unhealthy and ultra-processed food that also tend to be more appealing, more desirable. And according to, for example, the data that have collected from multiple research done in Malaysia, we also see more modern food retailers such as hypermarket, supermarket, and convenience stores. And we also have slowly more of a decline, or we don't see much of a growth of traditional food retailer like Pasar Tani, wet market, and also small grocery, family-owned grocery store. And the traditional food vendors usually are the sources, important sources of fresh produce like fruits and vegetable and local produce. Modern food retailer, they do offer fresh produce like fruits and vegetable, but they also offer a much bigger, wider variety of processed and ultra-processed food that tends to be high in energy, high in fat, and less in nutrient. So while we have healthy food sources, we have a much higher availability and abundance of unhealthy food in our environment. And moving on to food affordability, we unfortunately, we don't have much of a data that actually look at the prices of healthy versus unhealthy food. But we do have the data on the cost of a healthy diet in Malaysia based on the FAO data. So what it shows that the cost on a healthy diet is about 5 ringgit per meal, of a healthy meal per person, and this is a general adult. So it's a bit hard to estimate whether the 5 ringgit is considered affordable or not affordable. We have to look at our income of certain populations as a nation. But what we can tell for now, based on the data that we have, is the people from lower income, those living in poverty, living below the food poverty line, will unlikely be able to afford healthy diet on a daily basis.
Right. Okay. So having said all of that and taking into the factors that you talk about with accessibility and affordability, with income inequality that we see in particularly in urban centers, with urbanization, people working longer, both adults in a household maybe working jobs more than one even. How should policymakers be thinking about public health interventions? With the health ministry's campaign to reduce sugar, how do we think further beyond just kind of an advocacy campaign? What needs to be done, or what policies need to be designed so that it can effectively target the social determinants of health that you talk about that are related to sugar intake?
Okay. When we want to talk about sugar intake or the problem diabetes, we cannot just look at one particular issue. Diabetes is also related to obesity, because overconsumption of sugar can lead to the overconsumption of calories. And obesity is a significant determinant of diabetes and our prevalence of obesity. We all know we are actually one of the most obese country in Southeast Asia. So when we want to look at health issues and we want to design public health interventions to more effectively tackle diabetes, we should make it more inclusive, that also look at all the interrelated problems such as obesity and other non-communicable diseases. And if we talk about health, we cannot look at it as an isolated problem the country is facing. Health is related in the context of healthy eating. Our food choices are interrelated to many aspects of our life. For example, our wages can determine the range of food that we can afford, healthy or unhealthy food. And our working hours can determine the remaining time we have to prepare and cook and purchase food, because healthy food tend to be fresh food, and fresh food require time to cook, to prepare, and you need to have the facility to store them properly. And then also we have the accessibility of public parks and sports facility, because health doesn't just come from healthy eating; it also comes from a healthy lifestyle. So what we need is actually a nutrition sensitive strategies that's embedded in a comprehensive range of national policies, from education, healthcare, city planning, agriculture and food trade, social protection, and labor. This means that we do not just encourage people to eat healthy, tell them to eat healthy. We need to first build an environment that is conducive for people to make that choice and to sustain it.
Dr. Teoh, based on your experience working in Singapore, can I ask you what strategies that you found particularly effective that the Singapore government had implemented? Is there anything that Malaysia can learn from the Singapore experience?
Definitely. When I was in Singapore, I was working for a company who actually was the service provider for the Health Promotion Board, and my responsibility involved conducting health talks and healthy cooking demonstrations for different segments of the populations, and we also help to manage some of their programs, such as the healthier dining programs that target the hawker centers. So I would say the key of very successful messaging and implementation was that they use a multi-pronged approach and with a very effective nationwide messaging. First, what they did was that they did not just educate the consumers or their population to eat healthy and to be more aware of their health. They also ensure in the first place there are healthier options available for them to choose, and also encourage the food manufacturer to reduce, for example, the case of sugar content in their beverages. For example, they have health talks and healthy cooking demonstration for different segments of their population. We have different activities for seniors living in senior living centers, people participating in community centers, working adults in workplaces, and children in school and even preschool. So their approach was really population-wide. Something like no one will be left behind. Children, adult, elderly, everyone are covered, and with quite a tailored approach, addressing their needs for their age, and also what are the nutrition concerns that they should consider. And also second, they also ensure that healthier choices are widely available and promoted by the government. So have programs like the healthier dining programs and the healthier choice symbol that actually encourage the food vendors such as eateries and even hawkers to provide healthier choice. For example, healthier choice, Hainanese chicken rice, healthier, for example, for their drinks, siu dai or kosong. And they also have encouraged the food manufacturers to endorse the healthier choice symbol by reducing their sugar level or the fat contents, etc. So these are the approach that they target, not just by creating demand, but they also create a supply of healthier choice. And third is the very effective nationwide messaging. When I was in Singapore, you can see promotional materials about the diabetes awareness campaign and healthier choice logo and healthier dining program everywhere, in workplaces, in cafeteria, restaurants, shopping malls, and even at bus stop. So it's hard. The messaging was very consistent, very ubiquitous. And it was hard not to notice them. And with this constant reminder, their populations will be constantly remind or nudge to make the healthier choices.
Right.
So I think these are the features that Malaysia can probably adapt to our context. So to implement a more multi-pronged approach to create that supply and the demand, and to use effective and nationwide messaging.
Right. Dr. Teoh, thank you so much for sharing your insights with us. That was invaluable. Thank you. That was Dr. Teoh from Khazanah Research Institute. We're going to take a quick break here and consider this. We'll be back with more on this topic. Stay tuned. Hi, welcome back to Consider This. I'm Melisa Idris. Let's continue our discussion about the Health Ministry's Sugar Reduction Advocacy Campaign, which was launched last year in a bid to encourage Malaysians to reduce their sugar intake. How successful has this been in modifying dietary habits of Malaysians? Joining me now is Dr. Geeta Appannah, who is the president of the Malaysian Association for the Study of Obesity. She's also a lecturer at the Department of Nutrition at UPM's Faculty of Medicine and Health Sciences. Dr. Geeta, thank you for being on the show with me today. Could I begin this conversation maybe getting your initial thoughts on the Health Ministry's Sugar Reduction Advocacy Plan, their Kurang Manis campaign? I mean, how would you describe its effectiveness to date?
Thank you, Melisa, and thank you for having me on this show. Back to your question, the evidence review shows there's no silver bullet solution to the nation's sugar habit issue, and we have a very huge issue on this aspect, in Malaysia. And a broad and balanced approach is our best chance of reducing sugar consumption to healthier levels and to see fewer people suffering from the consequences of too much sugar in our diet. In that line, the Sugar Reduction Advocacy Plan in Malaysia, like similar initiative in other countries, aims to address the growing concern of excessive sugar consumption and its impact on public health. And this effort has been currently underway. It's just launched last year. I was informed it was end of last year, and will eventually be expanded nationwide. It has been started in Putrajaya at the moment. So the effectiveness of this plan hinges on various factors, including how well the plan raises awareness about the health risks associated with excessive sugar intake and educates the public on making healthier choice. If it effectively communicates the disadvantages of sugar consumption and provides practical guidance on reducing the intake, it may lead to a population positive behavior change, which is huge. This is very powerful, but it should have those aspects at the population level. And secondly, we have to make sure the accessibility to healthy options are there. Well, we are talking about removing the unhealthy part of our diet, which is sugar, but we don't really make a case for healthier options. So making healthier food and beverage options more accessible and affordable can encourage people to choose them over high sugar alternative. And this could involve initiatives such as promoting the availability of fresh fruits and vegetables, reducing the price gap between the healthy and unhealthy food, which is, again, is a huge thing to look at, and improving nutrition labeling on our packages or products.
Okay. I wanted to sorry to just jump in here, but I wanted to ask you about some of the suggestions that have come out. I mean, tackling obesity seems to be a kind of society-wide conversation at the moment. There's been proposals even to cancel the operating licenses of 24-hour eateries like mamak shops and all that. The idea is to reduce the effects of us having kind of late night meals or high sugary drinks. Well, what do you think of this proposal? Can we think through the pros and cons of this?
Okay, so the proposal to cancel operating license of 24 hours eateries is aimed to prevent mainly the late night eating, which is a social norm, a social culture for most number of Malaysians. So these cancellations of 24-hour, the license of 24-hour eateries could reduce, the access to high calorie, high sugar, high fat food during these late night hours. So this is what is seen, like during the late night hours, people normally go for this kind of pleasurable food, just mainly high in those calorie, sugar, and fat. And this could potentially lead to the cancellation can potentially lead to decreased consumption of this unhealthy food, which may contribute to lower obesity rates and improve the public health. The cultural phenomenon of 24-hour eateries contributing to a lifestyle that falls short of well-being. Yeah, in Malaysia. So this is a concern, and we are one of the nation with highest number of obesity prevalence in this region. Yeah, and there is solid evidence in highlighting obesity as a major risk factor for various diseases such as diabetes, hypertension, some of the cardiovascular conditions, certain cancer, musculoskeletal disorders, and psychological impacts, especially among the young people. And if we don't do anything of such, the current trajectory may continue. And if our policy fail to address this issue, we're gonna lose so much money by 2035, and this is as much as US dollar 20 billion. Yeah, and this is by 2035, not too long now. 2035. This is a projection done by World Obesity Federation in 2023. So that's a substantial amount of money that we could save merely by preventing the excessive weight and BMI. And in fact, and this is the main, should be the main economic aspect that we all should consider as a nation. Yeah.
Well, since we're talking about money and thinking about the ways this obesity can impact the finances of a country, are there ways to disincentivize people from consuming sugar? Should we be thinking about financial ways to disincentivize people? Sugar taxes, for instance, are they effective in reducing sugar consumption? Is that an avenue governments should be thinking about if they really are serious in reducing sugar consumption?
Simple answer is yes. This can be explained from a couple of perspectives. Yeah, if we look from the economic viewpoint, when the price increases, the demand decreases, and it's as simple as that. Yeah. Besides price, we also have what we call a signaling effect of sugar sweetened beverages tax, such as the publicity surrounding the tax that may contribute to public awareness on this sugar sweetened beverages consumption. And evaluation on the types of sugary drinks in a range of countries have consistently found that people consume fewer tax drinks, according to a pool review evidence published in 2022. Yeah, so this is evidence telling, like, sugar tax has got a good positive consequences as reduce intake of tax drinks. In Malaysia, an evaluation study on the impact and evaluation of our own SSB taxation by a team of researchers from UPM found lowered consumption of sugar sweetened beverages among adolescents in 2022. Yeah, so this is after implementing the SSB tax, after 3 years of implementation of SSB tax, and we found that adolescents seems to have reduced the intake of sugar sweetened beverages, which is good. We haven't done this without, so that's one effective studies that we have to do soon, I suppose. And similarly, findings from other countries who have implemented sugar sweetened beverages tax way before Malaysia, for example, Mexico and the United Kingdom, they also found reduced consumption of sugary sweetened beverages after the implementation of tax.
Dr. Geeta, can I ask you, do you think people are aware just how much sugar is in these drinks? I'm just wondering how you would describe the level of nutrition literacy amongst Malaysians. I mean, how would you describe it?
Well, it's very poor. So nutrition literacy, let me define what is nutrition literacy. It refers to the ability of individuals to understand, interpret, and apply those nutrition-related information to make much more informed and healthy food choices. So unfortunately, we don't have any national prevalence on the level of nutrition literacy in Malaysia. However, there are a couple of small studies conducted by researchers from Geeta and also UPM in Malaysia indicated that half to two-thirds of our Malaysian adults were having poor nutrition literacy score. And this was assessed using various questionnaires respectively. And apart from that, at the national study, the Ministry of Health Malaysia introduced a Malaysian healthy plate concept. I'm not sure if you know this, illustrating the ideal composition of a balanced meal: 50% of fruits and vegetables, 25% of protein, and 25% of whole grains and carbohydrates. Yeah. We call this as suku-suku separuh plate. the shocking truth is that 4 out of 5 Malaysians did not know what is a healthy plate was. So a mere of 20% of Malaysians recognized its significant, and only 14% of adults in that group practice healthy, balanced diet. And other than that, on a national scale, data from Global Nutrition Report in 2018 reveals that Malaysians consume the least number of vegetables and fruits compared to other Southeast Asian countries. So that's how the data is showing. So in terms of nutrition literacy scale, we are way backward in that sense. Yeah.
Right. Okay, so Dr. Geeta, we've run out of time, but I think we need to come back and explore further how we can increase the nutrition literacy, but also what policies and interventions can be taken to improve kind of dietary habits of Malaysians. But I want to thank you so much for joining me on the show and sharing your insights with us today. Appreciate your time. That was Dr. Geeta Appannah from the Malaysian Society for the Study of Obesity. And that wraps up this episode of Consider This. I'm Melisa Idris signing off for the evening. Thank you so much for watching and good night.